and welcome to the research portion of the Urban Polling Activator course for rehab professionals. My name is Joy Cochran. I'm a doctor of physical therapy and the clinical evidence specialist for urban polling. I will be your presenter today as we explore many of the evidence-based articles on the benefits of pole walking. As well, we will touch on some of the ongoing studies specific to urban polling and the activator polls. With hundreds of research articles pertaining to pole and Nordic walking, we will focus our review on the higher caliber articles, such as systematic reviews and randomized control trials, but also highlight a few case studies and pilot studies that are out there. So let's get started. The first article is a systematic review by Fritzi et al. In 2012, looking at the effects of pole walking on the health of older adults. It encompasses 14 articles, and of those, only 6 define the specific walking techniques, which was mostly Nordic walking. The others did not clarify. Most had programs that were 8 weeks in length, had supervised group sessions, and met 2 to 3 times a week. The conclusion was that pole walking programs have some beneficial effects on both physical and psychosocial health in adults with and without clinical conditions. Reporting that most of the physical assessments measured cardiorespiratory health. So let's take a closer look. I'd like to point out 2 very different systematic reviews that investigated the physiological response to pole walking. The first one from 2013, specifically comparing Nordic walking to brisk walking or jogging for conditions such as COPD, Parkinson's, peripheral artery disease, obesity, diabetes, low back or leg pain, neck pain, people that are sedentary, fibromyalgia, depression, breast cancer rehab, and healthy adults. And the other article by Saller et al. In 2023, observing sports that use poles. The ones specifically pertaining to us would be Nordic walking, hiking, uphill walking, and trail running. Although the subjects are very different between the articles, the results are similar. Pole use helps increase caloric expenditure and oxygen consumption, with Cooper Institute reporting as much as 20% and as high as 46%. Increased heart rate, but no increase on the rate of perceived exertion. So what this is saying is that poles are increasing the intensity on the body for a more impactful workout, but participants are not feeling that increased exertion. In this other article, Gobble et al. Even went so far as to make a recommendation for the prescription to help with weight loss. So with this systematic review, he came to the conclusion that you should be Nordic walking 4 to 5 times a week for 60 minutes, combined with diet control, and you'll have a great weight loss program. This next systematic review and meta-analysis is specifically looking at the elderly. I really don't like that term, so we'll default to older adults going forward. Anyway, Bulow et al. Concluded that Nordic walking is a safe and accessible form of exercise for older adults and found that it improves their muscle strength, balance ability, and again, like the previous articles, cardiovascular systems and quality of life. As a side note, I would like to point out that there was very little overlap in the articles utilized between each of these systematic reviews. This next pilot study is out of Hudak Cape Breton University in Nova Scotia, Canada, and specific to the activator polls. They were exploring the effects of a healthcare provider-led physical activity and education program on indicators of fall prevention and subsequent independent living. The study was 9 weeks in length and followed the Otago Falls Prevention Program, but modified to use the activator poles during those exercises. If you're not familiar with Otago exercises, it is a CDC-backed and evidence-based fall prevention program consisting of 17 exercises. Some examples of those exercises are standing hip abduction, extension, sit to stands, and walking sequences such as backwards walking and figure 8. If you're not familiar with this program, I'd highly recommend Googling it. It is a great program and they have a very inexpensive certification course. What was found from the study was that there is a significant change and improvement in the following tests: the timed up and go, which is a matter of standing up, walking a short distance, and turning around, so all functional skills. The participants improved in their stride length, as well as increased the amount of time that they could stand on one leg. All of these tests and assessments are actually indicators of fall risk. Let's switch gears a little and move on to neurologic conditions. This first randomized controlled trial by Kang et al. Was specifically observing people with stroke and the effects of treadmill training with and without poles. They concluded that after their 6-week program, the Nordic walking group saw a more significant improvement in their gait, balance, and activities of daily living. Moving on, we are going to look at the effects of Nordic walking on cognition in patients with Alzheimer's disease. The results of this new 2023 randomized control trial showed that the Nordic walking group had significant improvements compared to the control group, with improvements in 4 separate cognitive domains, including visual spatial reasoning abilities, verbal episodic memory, selective attention, and processing speed. As cognition declines, it can become hard to engage individuals in activities that are meaningful and impactful to maintain aerobic capacity. Walking is a great way, as it is largely a subconscious task for most people, and the feedback that we commonly get is that by adding poles, participants are more motivated and engaged. Quite a few studies showing the benefits of Nordic walking for people with Parkinson's, but we're only going to touch on 2 today. This meta-analysis of present physical therapy treatment modalities for people with Parkinson's concluded that Nordic walking interventions significantly improved or had a moderately large effect on Parkinson's-specific motor symptoms, such as tremor, stiffness, and slowness. It also showed improvement in balance, as measured by the Berg Balance Test, and improvements in gait outcomes, as measured by the 6-minute walk test. This 2022 systematic review and meta-analysis showed that many articles identified improvements in such areas as global motor impairment, functional mobility, balance, and physical fitness. But the ones that showed clinically significant improvements showed it in areas of walking ability and quality of life. Lastly, we're going to check out some orthopedic-related issues. This first article is specific to female breast cancer survivors and looking at the effects of pole walking on shoulder function. What they came to the conclusion was that pole walking made a significant improvement in their muscular endurance of the upper body, which is beneficial for breast cancer survivors to perform activities of daily living and to regain independent lifestyle. There are additional articles and therapists that specialize in treating people with cancer that have reported poles help additionally with scar management, shoulder range of motion, lymphedema, depression, and vestibular deficits that are caused from the chemo. Pole walking can reduce the ground reaction forces and offloading of lower extremity joints, specifically at the knees and hips. Some articles report the use of poles can remove up to 11 to 34% of pressure on those joints. And a few of those articles are very specific in regards to the technique that will take off the most pressure. The technique described is that of the Activator technique, where the poles are in front and perpendicular to the ground. This article by Silverberg et al. Was conducted with 100 ambulatory people aged 60 and over that have chronic low back pain, hip, or knee pain while walking. And they introduced them to Nordic walking for a 12-week duration. At the conclusion, 91% of the subjects said that Nordic walking significantly reduced the severity of their low back, hip, and/or knee pain while they were walking, and it also allowed them to increase the distance that they walked, which is pretty significant, especially for those people that have severe pain on a regular basis. pause and look at the impacts Nordic walking has on mood and depression, as it is so relevant in our profession today. A lot of clients, when diagnosed, will have feelings of depression and/or anger. I always say that if I had school to do over again, I would get my undergraduate degree in psychology, as it would help me so much as a therapist. This first article by Lee et al. In 2015 was specifically looking at frail old adults and came to the conclusion that Nordic walking was more effective than regular exercise in reducing depression. The article by Suji et al. In 2009 was specifically looking at patients that have a diagnosis of being depressed between the ages of 25 and 80 years old. And they found that Nordic walking increased their patients' physical activity and improved their mood. This last article by Stoughton in 1992 was specific for adult women, and it showed that Nordic walking improved mood. They expressed less fatigue or felt less fatigue. It decreased their depression and their anger. One other article I'd like to point out that's not on this slide is by Stark et al. In 2012, and it showed that a single bout of self-paced supervised Nordic walking had an effective improvement on acute psychological well-being in patients with affective disorder that were in the hospital. So just a single bout can have effects in regards to mood and depression. All right, this is one of my favorite case studies, not because of the poor subject, but because of how the clarity that it shows in regards to the benefits of using poles in an objective measure, because she's going to be on a force plate. So the subject is an 88-year-old female. She's had 2 shoulder replacements, 2 hip replacements, 2 knee replacements, a neck fusion at C1 and C2, and an old soft tissue injury at the ankle. But she is walking on a Xeno walkway, which is a force plate. So it's giving us very objective measurements and not just the subjective measurements that we would use from visually watching her walk. So let's take a look. Without the poles, she has an exaggerated arm swing and what I would call a waddling gait pattern, right? So that wide stance, short stride, slow speed, and her gait is very varied. So let's take a look at what she looks like with the poles. So her arm swing is more appropriated to her cadence, and she has an improved step length, which step length is the primary determinant for minimal toe clearance, thus critical for reducing falls and is an independent predictor of cognitive decline. And if you see her on the way back, you can definitely tell that she's getting better toe clearance. So let's look at it side by side. We have reduced width in our gait, we have longer strides, and more consistency with the poles. But let's see what the objective measurements say. So with the Activator poles, she has increased her speed by 37%. And as we know, gait speed is the 6th vital sign. Gait speed is considered valid, reliable, and a sensitive measure appropriate for assessing and monitoring functional status and the overall health in a wide range of populations, including older adults. She has an increased step length of 62%. We already talked about how crucial that is for that toe clearance. But stride length is also directly involved in mechanisms of poor balance, which have been shown as a marker of low survival, physical disability, and other adverse clinical events. Her stride width has decreased, her gait variability improved, and her cadence decreased by 15%. I would say these are all huge. It was also found that the step lengths collected for people with Parkinson's while they were Nordic walking was very similar to the healthy population. The next article by Park et al. Researched healthy adults, and they found that Nordic walking increased cadence, stride and step length, and decreased the vertical ground reaction forces. This would suggest that they increased their gait speed if their step length got larger and their cadence increased. They concluded that Nordic walking should be considered a good way to help patients with diseases affecting their gait, as their findings demonstrate that Nordic walking is effective in improving functional capacities by promoting effective energy use and reduced pressure on joints. This concludes the research portion of the Urban Polling Activator course for healthcare professionals. As we only touched the surface on the hundreds of evidence-based articles available regarding the benefits of pole walking for many different populations, I hope you have gained an understanding of the impact that poles can have on improving the lives of people that you treat for a number of conditions from ortho to neuro. We'll see you in the live sessions. Thank you.